In longevity medicine, we know that hormones do help you to live a healthier and even longer life. Today we'll be talking to our hormone expert, Dr. Anthony Bazzan, about how to maximize hormonal health as we age. I'm here with Dr. Anthony Bazzan, Medical Director of Thomas Jefferson University's Marcus Institute of Integrative Health. Dr. Bazzan, welcome.
Good morning, Dr. Monti. Thank you for inviting me to be here.
Dr. Bazzan is an expert on longevity medicine. I know a lot of factors go into optimizing living longer and living better. What is the role of hormones?
Well, that's a great question because they make things happen. And when things don't happen because the hormones are leaving, well, that's the beginning of a lot of issues and a lot of problems. Generally speaking, we have two categories of hormones. The ones that are most famous are basically steroids. So what is a steroid? It's a particular formula. They look like little pentagons and hexagons. And they come from the squalene, which is the shark liver oil molecule, which then gave birth to cholesterol, who then gave birth to all the steroid hormones. Now, there are other categories of hormones, and those are protein hormones. Proteins are sequences of amino acids, and these hormones are basically a necklace of amino acids that then get secreted in the blood, and they tell the tissues what to do. And a classic example of that would be the thyroid hormones. Whereas the classic examples of the steroid hormones are the hormones that everybody hears of: the testosterone, the progesterone, the DHEA, the estradiol, estrogen. These are all cholesterol offspring, if you want to call it that. Now, these hormones are anabolic. What does that mean? They take a baby, like that and growth hormone and all these things. They take a baby and they make him into an adult. And as long as the adult generates these hormones, the body stays around, I say, right? But when you go into menopause and you start losing these hormones, then the phase of life that we call catabolic starts. And this is where the bones go away. Hence osteopenia, osteoporosis. This is where the muscles go away. Sarcopenia, which is now very much studied in science. And all of these, set of reactions that basically where the body is living. That is completely tied to longevity. So basically there is a relationship between scientific studies that show that the decline in hormones create a shortening of the lifespan. The link is the destruction of tissue, the loss of muscle, the loss of bone, the loss of brain, the shrinking of everything, because the body is unable to keep generating its own tissue to survive.
So the symptoms and body changes that a woman goes through in menopause is because of the loss of the anabolic or building effect of estrogens, and I'm sure you're going to tell me more.
Yeah, absolutely. So these are a big part, not the entire part, but a big part of what happens. Also, we need to remember that these estrogen hormones work on gene expression. And so there are certain genes like the FOXO3, there are the sirtuins that became very famous about 10 years ago about longevity and living forever. These are all gene pathways that influence how the body is built, and they are directly related to the presence of these hormones. And so when these hormones go away, these pathways begin to falter. And everybody knows that people that get older, they shrink. If you look at, the menopause symptoms, the vaginal dryness, and the shrinking of the actual brain. The radiologist will always comment that there is a certain amount of brain shrinkage, brain matter shrinkage. Why? Because it's related to the loss of hormones and the loss of, the activity of these genes. Now, moving to testosterone, that's important to understand that women have 20 times more estrogens than males, and males have 20 times more testosterone than women. This is why males have male bodies with that muscle mass and that bone mass, and the women have theirs. So this is why you see a woman starting the menopausal process and the bone loss in their 50s, but it takes to get into the 80s before you see that in a man, right? Because of where they started from. Testosterone, therefore, for women is crucial in order to bring back their bones and their muscles when they lose them in the menopausal state. And that's directly related to longevity. And studies are clear that, and we're all aware of the controversies about pharmaceutical hormone replacement, and the appropriate hormone replacement rejuvenates the body and prolongs lifespan. When it comes to males and longevity, testosterone is crucial. Males begin to lose about 1% per year after 30 years of age. And studies are clear that hypogonadism, which is the medical term for low testosterone, is absolutely related to an increase in all-cause mortality.
All-cause mortality.
All-cause. That means that men with low testosterone will die sooner for all kinds of reasons.
Wow.
Cancer, strokes, heart attacks, you name it. They just don't last as long. And studies are showing up to a 35-40% increase in lifespan to the men that receive testosterone when they don't have enough. Now, the art of testosterone replacement is nuanced because you need to do the right thing with the right patient at the right time based on the circumstances. You know, when we talk about hormone replacement, it's a very precise practice because it takes into consideration all the blood levels, the person's level of health, their medical history. But the upshot of that is when it's done correctly, it's extremely beneficial.
It's such an important point too, because if it's not done correctly, then there's risks.
Yes. We jokingly say to our patients, the fact that a pinch of salt is good in the soup does not mean that a pound of salt is good in the soup. And so many times, you know, in my practice, we see patients who come to us who have been grossly overdosed. Mm-hmm. And that has problems. Mm-hmm. And so we correct that. And of course, you know, if you are underdosed, that you're not going to get the results that you need. So.
And I know there's other issues. I know in your practice, since a lot of my patients see you, you're looking at things like the prostate and other issues that are important to be following while people are getting hormone replacement.
Right. It's pretty fairly accepted now that testosterone therapy will not give you prostate cancer, but it could promote the growth of the prostate cancer, which it was already there.
Which is why you're checking the prostate when you're getting
So
hormone
we're very
replacement
careful
therapy.
about that. You know, we do blood work, we do specialized blood work, we do imaging, and we make sure that, you know, the person is qualified, you know, appropriate therapy for them.
And then you do the same for women as well.
Absolutely. We are able to actually test for metabolites, meaning versions of estrogens that we know are cancer promoters. So we have enough technology now to be able to see if a woman directs her estrogen production down the pathway that creates the type of estrogen that favors the growth of cancer. And if that's what's happening, we are very good at stopping that immediately. So happily, there's a lot of technology we can use to do the right thing and keep people safe for these therapies. Back to the men, there is a special testosterone metabolite called dihydrotestosterone. And this is, you know, and depending on the person, certain people, when they go on testosterone therapy, they shunt down into the dihydrotestosterone therapy and it goes too high. That's not good. That's, you know, that increases the size of the prostate. It's part of the hair loss. And these are all things that we consider when we treat patients.
Great. So in terms of like living a longer, better life, what kinds of things do you see in patients who get the hormone replacement therapy you offer?
A clear improvement in both their quality of life and in their physical body composition. Having said that, hormone replacement has its place, but there also are a lot of things that can be done to improve longevity and hormone production in the body even before we get to the point that we give hormones.
So there's other things people can do.
Absolutely.
To improve their hormone levels.
Yes, and so diet is very important.
Mm-hmm.
So after 50 years of age, we say what you eat will decide the rest of your life. the diet is the most important factor of what will happen to you for health or disease. That is, nothing else beats that. No, not the supplement, not the hormone replacement, not the drugs, nothing. It's been clear to us for decades now. So that's the one thing that we immediately make sure that people get off diets that are disease makers.
Do you ever find that dietary interventions improve hormone levels?
Yes.
So some of your patients don't even need or get hormone replacement therapy.
Right. And this is part of our medical work. In other words, we identify where the person is at that point, particular point in their lives, and then we say, okay, these are the options. You could do this without the replacement of the hormones. Let's see if you can do it. Whatever your body can do on its own and come back and produce the same level of hormones or nearly the same level of hormones that when you were younger, that's the first strategy that we should employ. And most people are very responsive to that. Now, there are cases in which it's clear that, or we tried, or it's clear that it's not going to happen. And so rather than leaving the person deficient in hormone with all of the consequences of that, then it's appropriate to give them the therapy.
The things that affect your natural hormone levels, aging is one, but that can be countered, at least to some degree, with things like diet.
Exactly. Exercise. We jokingly say that the thighs are the testosterone factory.
That the thighs are the testosterone factory.
The bigger your quads, the more testosterone you make. So most of my patients now are working very hard, working on leg exercises, to improve to increase the size of their quads, right? So, but it's all go around the entire body, and also when it comes to DHEA it's sort of another androgen, which is, call it the brother to testosterone, which is not as powerful, but it's very good for anti-aging, anti-inflammation, to keep the brain. It's an anti-autoimmune hormone, and regularly that will improve with exercise. Even more than with testosterone.
Okay.
We see that because we always check blood work on everybody and we follow it.
So all of the hormones, including DHEA, improve with exercise, and including estrogen, right?
Including estrogen. That's a little harder in postmenopausal women, unfortunately. Ovarian function. See, the problem with that is the reason of menopause is that the woman runs out of eggs. So the factory is closed. The testicles never quit. Even if the man is 85 years old, the testicles are still there. Right. The cells are alive. Are they producing as like they were 30? No. But can they improve? Yes. So with the males, it's easier to put lifestyle factors in and see improvement. Unfortunately for the girl, for the ladies, the factory is closed.
So more often you have to add some hormone replacement. But those other things that they're doing help to make that a better process.
Yes. The exercise without the hormonal replacement, say, will give an ROI of $5. The exercise with the hormone replacement will give an ROI of probably $10. It'll double it up. Women come back with these smiles on their face. I can do more weights. I'm losing the fat. I'm stronger. I look better. My body looks younger. Because now the exercise gets complemented by the hormones are back. And so the bones come back and the muscles come back. The moment you do that, you start burning fat more like when you were younger, because people forget that bone tissue and muscle tissue burn calories 24/7, even when you're sleeping. This is one of the most frustrating things that happen to women. They go into menopause and then they put on 10 pounds at the end of the year. They haven't changed their calories, and they're saying, why? What's going on here? And then many times they blame the thyroid, and the thyroid is like, no, I didn't do anything. It's the problem is that they are losing muscle mass and bone mass, and they're not burning the same amount of calories that they used when they were younger, but the calorie intake is the same, and so they put on the weight.
And the other lifestyle factors that affect hormones directly are things like stress and even sleep.
So those are big. And so sleep, happily, one of the hormones that we give, especially for women, basically for women, is progesterone. And happily, progesterone restores normal sleep in the vast majority of postmenopausal women. Why? Because that's how the brain works. There are metabolites of progesterone that are used by the brain to get people to sleep. And so when we put them back, women feel it. And at the same time, they're also good for anxiety because these are hormones that work in brain function. We call them neurosteroids. They have been called sex hormones forever, only to realize now that they are even more important in the brain. And a lot of the problems that women face when they have emotional swings or mood changes when they go into menopause is because these neurosteroids are no longer there.
Since these hormones are so critical for aging better and perhaps aging longer, what would you recommend the average person do if they're feeling, a male or a female, that maybe the hormone levels are going down based upon some of the common symptoms that people hear about?
They should seek appropriate medical help, hopefully with doctors that have the training that we have, as much as possible.
What kind of basic lab tests would they be looking for when they go to see their doctor?
So let's say for females, one would be called the FSH.
Follicle stimulating hormone.
Right. And that pertains to the domain of the estrogens. The LH.
Luteinizing hormone.
Right. The estradiol level. There are 3 estrogens, but we only check the estradiol because in practicality, that's the one we need. The progesterone levels, the testosterone levels, that gets divided in free testosterone and total testosterone, and then the DHEA levels. These are the hormone tests as far as the ovarian function and the adrenal function, because DHEA is actually made in the adrenal glands, goes.
And you also check thyroid?
Of course. Always, again, that's not a steroid hormone, but thyroid function is crucial.
And what about in males?
In males, then testosterone is everything. So the number 1 would be testosterone total, free testosterone.
Why is it important to test free testosterone?
Total testosterone is protein bound. So the actual effect in cellular activity and metabolism of a protein bound hormone is almost nothing. Whereas it's the free form that circulates in the blood and then goes to talk to the receptors in the cells, and then the receptors internalize inside the cell the message of the hormone so that now the cells are going to obey.
So do you ever see people who have a normal total testosterone but an too low or abnormal free testosterone?
All the time.
All the time. I think that's important because sometimes people get a total testosterone level, but they still feel depleted, and the answer might be that that the free testosterone never got checked.
We actually smile because we know that when the blood work comes back with the high total testosterone and the low free testosterone, when the door opens and the person walks in, they're not going to be happy. Both men and women, particularly women. Testosterone is interesting, has an antidepressant quality in the brain. And it's also a motivating quality. So jokingly, we say to our patients, when you're on testosterone appropriately, you are whatever you are. You don't say, I am 60 years old. You say, I'm 60 years young. And then your attitude changes. You feel like, I can't get a new job. I can't get this done. It's a motivator. And
there have really been a lot of studies to show that low testosterone leads to depression, and repleting it can help depressive symptoms.
Absolutely. And the other interesting part is progesterone is an anti-anxiety.
Yeah. So for men, you would check testosterone, free testosterone.
And then 2 more important ones, DHEA, obviously, and then dihydrotestosterone and estradiol.
Why estradiol?
Because some men turn their testosterone into estrogen. And that could be a problem. And this happens more in people who are obese or in certain ethnic groups. So we always check that. And the process that's called aromatization.
And so that's why some men as they age get these feminizing effects, because they actually have high estrogen levels.
Yes.
And that's from the conversion of testosterone into estrogen.
And that has to do with how the person was made. Certain people do not aromatize easily. Certain others do.
Are there things you can do about that to correct that?
Losing fat, exercising. Alcohol is not a good idea. A lot of medications can do that. So these are all things that have to be, taken into consideration. Now, we also have supplements and medications to stop that from happening, happily. And so we don't like to see an increase in the estradiol. We don't like to see an increase in the dihydrotestosterone in men. So we follow them very strictly to make sure that whatever testosterone we give them remains as much as possible free testosterone. Also, when it comes to low free testosterone, it's been associated with dementia. Another thing that people can do is use appropriate phytochemicals, because there are certain phytochemicals that can help improve levels of hormones.
What are phytochemicals?
Basically botanical, plant parts. Like for instance, fenugreek is very famous for helping with blood sugar, but it's also good to increase your free testosterone. And there are other botanical plant parts that are able to do so. So many times we will also employ those to see if the person will respond appropriately. And another factor is stress and distress. So stress can be helpful, but distress is not. So when people are very stressed out, that also has an impact in hormone production, which then sums up with the other problems. So meditation, prayer, working on one's own values and validation in their lives, we have seen over time are also a good component of improving hormone function.
So as we've learned today, hormones are critical for our health and longevity. There are ways that we can maximize our hormonal health naturally. And when that's not enough, there's ways to supplement our hormone levels safely and healthfully. I'm Dr. Dan Monti. Until next time, be well.